My name's Dr. Lederman, and I'm here with...
Nicodemus Ellis.
And we've known each other for a long time, right?
Yes.
And you came in trouble. You came in trouble almost 6 years ago, right?
Almost 6 years ago.
And you were going to have surgery, radical surgery, when you came over here, right?
Yes, yes.
And you had a high PSA, right?
Yes.
And you had some urinary issues.
Very, very serious issues.
But more importantly, you had a biopsy. And your biopsy at one of the biggest hospitals in New York, right?
Yes.
Showed a Gleason 8 cancer.
Yes.
Right? So you had 6 biopsies in your prostate, and 5 of the 6 showed cancer. And Gleason is how the cancer looks under the microscope, and Gleason 8 was one of the most aggressive cancers.
Yes, that's what you told me, Doc.
And we talked about that when you came almost 6 years ago.
Almost 6 years ago.
And you had been scheduled for surgery. The surgeons over there wanted to operate on you, right?
Yes, they wanted to do that conventional surgery.
Radical surgery. They wanted to remove your prostate.
Yes, they want to remove the prostate. Yeah.
Even though at that time you were 70 and you had heart disease and you had other medical conditions, right?
Yes.
Did they tell you that not everyone lives through the surgery? Sometimes there's complications from the surgery?
Yes.
Did they tell you that?
They told me that, yes, a lot of complication, it's not a guarantee that, things would go, perfect as I maybe wanted to, but...
Why do you think they wanted to do surgery? You were a little bit older, you had heart disease and other medical conditions.
I was a bit concerned about my condition at the time too, so I was reluctant on doing it actually. And then...
So you really refused the surgery, right?
Yes.
Because you were going to have surgery in April and you came to me a few weeks later in May.
Yes.
And why'd you come to me?
I was recommended to you by a cousin and a friend and ex-co-worker of mine from back in Jamaica.
So were they treated here? Or do they know people who were treated here?
They know people who, been here and... they were really satisfied with the result that the patient that came to you gave them, So they encouraged me not to do that surgery before I come and see you.
Okay, so we met and we talked about everything, I think, right?
Yes, we did talk about everything.
Do you remember that meeting?
I remember that meeting. You told me first that, you were happy that I took my cousins and my friends' advice and did not actually go through with that surgery because probably, I would be in some problem after that surgery.
Well, you said I'd be happy, but I think you would be more happy.
Of course.
Right?
Of course.
And did your doctors over at that super place tell you that you had a Gleason 8 cancer? Did anyone tell you that?
Actually, they did not tell me the type of cancer that I had.
Did they ever? So they didn't tell you actually what it meant to have a Gleason 8 cancer?
No, they did not tell me.
But we spoke about it here that day.
Yes, when I came to you, you told me exactly what was going down.
Do you remember what we talked about, Gleason 8 cancer?
It was a very serious cancer, and need to be taken care of, and I decided at the time, after you explained everything to me, I said, I would stick around with you.
And no one ever told you over at their Super Duper that with Gleason 8, most likely the cancer would come back after surgery? Did they tell you that?
They did not tell me.
Well, we talked about it here. You saw the information.
Yes, I saw everything here. And I was, satisfied and convinced that I want to go along with your treatment.
And do they tell you over there that most men who have radical surgery end up impotent and leaking urine?
They did not tell me that.
Did they tell you that their vital organ gets a little shorter after surgery often?
Even that they did not tell me.
Yeah. So you had the treatment here. You chose the treatment.
Yes.
And do you remember anything about the treatment?
Well, I remember the treatment was was.
Did you have any side effects from the treatment?
Satisfactory, yes.
Did you have any side effects or pain or suffering?
No, I did not.
So you went through the treatment. And you did not have any side effects from the treatment? Is that right?
No, I did not have any side effects.
And since that time, you've been doing well, right?
Very well.
I mean, you look great. How old are you now?
How old am I now?
You just had a birthday, I know.
Yes, I celebrated my birthday last month, the 20th. Thanks again for that gift.
Okay.
Yeah, really.
The gift had nothing to do with this video. The gift is because it's your birthday.
Yes, yes.
And you're, what, 76 now?
I'm 76 now.
76. So it's 6 years later. You came at age 70 and you're now 76.
76.
And your PSA, we talked about it earlier, it's 0.11. It's the lowest ever.
Of course. And when I came here, it was like 6, 7 or somewhere about there.
6, 7 with a Gleason 8.
Yes.
And it's kept on going down over 6 years.
Over 6 years. Yeah.
And you're doing well.
Very well.
Is your quality of life good?
Yes.
Is there any limitations in your life?
Well, limitation meaning?
Are you living a full life of what any 76-year-old man?
Of course I am.
So you have no pain, no suffering?
No pain, no suffering, no running to the bathroom, no pain, peeing again like I used to before I come to you. You know.
Okay, but the main reason, those are good things, but the main reason is actually to get the cancer go away.
Yeah.
And your PSA is at the lowest level, 0.11, so it's really good. What do you, the men that told you to come here, do you ever see them anymore?
What is
you
that?
saw some men, cousins and others who told you to come over here.
Yeah, I do see them. I do see them. My cousin, I see my cousin, but my friend, he moved to Florida now, so we just speak on the phone more time.
And do you talk to them about their prostate and they talk to you about your prostate, or it's all forgotten now?
Yeah, I talk to them, about it, and I thank them every time for, recommending you to me.
Even years later?
Even years later, yes.
What do you tell to men who don't have prostate cancer? Jamaicans have the highest rate of prostate cancer in the world, it said. The ambassador of Jamaica was here, and we offered to help. In fact, in the whole Caribbean, there's a lot of cancer. So what do you tell other men who don't go checked out? What do you tell them?
I tell them, I told them, once you reach age 45 or 40, make sure you have your prostate checked on a regular basis. As a matter of fact, I don't know if you familiar with, I don't know if it's you, but you was the one that I recommended him to, a cousin-in-law of mine. His name is Colin.
But we don't want any names.
Oh, okay,
No names.
okay.
We don't want their confidentiality.
I recommended a cousin-in-law of mine.
Okay, so it's 6 years later, your PSA is 0.11, you're in remission. And by the way, you never had any other treatment. There was no surgery or chemo or anything else. It was only our treatment here, right?
Only your treatment here.
So there was no other chemo or surgery
Nothing.
or cutting or bleeding or anything else. Our treatment only.
Your treatment only.
Okay, was everything that we told you straight and honest?
Straight and honest.
How were you treated by the staff, by the way?
Very, very, very good, kindly. Your staff is very professional.
Any regrets about anything that happened about the treatment of your prostate cancer?
I have no regrets.
Okay, well, we say you should live to be 120 years old. We want you to live to be 120 in good health. Okay. And we'll get checked up. You come on a regular basis to get checked up about twice a year, and everything is A-okay right now.
Everything is okay.
Okay, God bless you and thank you. And thank you for talking to other people about your situation.
Yes, I do, on a regular basis.
Okay, thank you so much. God bless you.
You're welcome, Doc.
Okay, thank you so much.
Thanks.